Mr. Speaker, I rise today to share with you stories from Colorado of real people. Stories they shared with me of why we need to pass health care reform. Stories I hold close to my heart as I do battle and encourage my colleagues to join in supporting President Obama's plan to improve health care in America. Jeremy Johnson from Colorado wrote to me the other day. He was born in Denver and lived in Colorado most of his life. Last November, like a lot of Americans, he lost his job. Subsequently, Jeremy lost his health care. That's the third time he's been laid off in his life. First time, he was unemployed because there were budget cuts at the University of Colorado, the flagship university in my district, and like a lot of public enterprises, has fallen upon hard times and budget cuts, and Jeremy lost his job there. He then went into several temp jobs and was eventually hired into a permanent position with Citibank in spring of 2006. He became eligible for their benefits program and went on to their benefits program, but a year and a half later, they eliminated half of the people in his department and moved the rest to Maryland. Once again, Jeremy found himself unemployed and uninsured. After searching for months for employment without success, he applied for part-time seasonal jobs with a large home furnishings retailer and started to work there to pay bills. He was able to earn insurance benefits for 3 months, but he lost those benefits when he was laid off due to the economic impact on the industry and on retailing. Now, shortly after his most recent layoff, Jeremy was diagnosed with a medical condition. He's afraid that when he finally gets insurance again, the treatment for that condition, the very condition he needs medical care for, will not be covered because it will be considered a pre-existing condition. Jeremy is an athlete. He considers his health important. He's competed in the AIDS life cycle from San Francisco to L.A. 2 years in a row. He's raised thousands of dollars for good causes through his races. Raised money, ironically, for treatment for people who are not covered by our current health care system. And yet Jeremy himself lacks coverage through no fault of his own. What we accomplish in health care reform is encourage employers to provide health care, give them access to exchanges, provide affordability credits. For individuals earning up to $41,000, $42,000 a year, they will receive affordability credits to take to the insurance provider of their choice to acquire insurance. Healthcare will become more mobile through the exchanges. Jeremy and millions like him will be able to take health care from one employer to the other through the exchange. And we owe to America that the millions of people in Jeremy's condition shouldn't need to worry about where their health care will come from should they suffer from an illness, have to worry about having a string of bad luck and layoffs because of the recession or job relocations. By passing health care reform today, we can give Jeremy and the millions like the peace of mind they need and the health care that they need to continue to contribute to our great nation. Thank you, Mr. Speaker. Mr. Speaker.